here, and I would assume it's not any different necessarily, there's just so many systems and policies and oversight, and some of it's governmental and some of it's from the institution and some of it is state and some of it is, it becomes just this horrific forest to try and dig through when you're potentially going through some of the worst stuff in your life.
Mm-hmm.
My mom passed from cirrhosis of the liver in 2008, but it took about 5 years from her diagnosis until she finally passed. And trying to navigate the system was some of the worst parts of that. And at that point, I didn't have any healthcare background at all. So we were all fumbling around blindly. And there are people that I remember that showed empathy and were able to help us. But there are ones that I remembered who really didn't care. They couldn't care. They were done. So,
they were in survival mode.
Yeah.
Why do you go into a healthcare profession thinking that, like, I heard this conversation the other day where somebody told me where nursing is not a calling, nursing is just a job. And as much as when I heard that originally, I took to that differently, because what I find very important is that, yes, there's a part of this that is a job. We're not going to take away from the technicality. It is a job. We're getting paid to do it, and we should be compensated properly. And that is a whole other conversation that I can get into, because in Quebec, we're one of the lowest paying in North America. However, and that was a whole other battle that we were dealing with in Quebec as well. But besides that, but going beyond that point, is that yes, we're just a job where we should be getting paid for it. However, if this was just a job, then anybody would do it.
Yes.
So if it was just a job, if anybody would do it, but if it was a calling, there would be a specific type of person that would do it. And I believe that everybody who's been a nurse or a healthcare professional for X amount of years, who has done the job, who's knowledgeable in the job, they were called to do it. It is a form of a calling. However, it's very, very, very tricky when you make it your identity. And this is the issue with burnout. This is the issue, is that when you are so fried in your calling that you forgot about who you are. And then that's where the identity and calling issue can kind of overlap a little bit, where there needs to be a little bit of a separation there for the sake of decreasing our fight or flight system a little bit, because of the intensity of the system and the working on less to do more aspect of it. It's the issues of the system, not the issue of the profession. And that's what we have to make very, very clear here, is that yes, it is your calling. It's just the system burnt you out, not the calling. And if it was the calling that burnt you out, you have to re-identify and repurpose yourself as to, where did I put too much and where did I put too little, and why am I overcompensating and draining at the bottom of my cup? And this is the huge issue that we have here, is forgetting the fact that yes, this is a calling. However, there needs to be proper boundaries to protect yourself and to protect your identity in order to can maintain that empathy at the bedside.
Yes. And I think that is a fantastic point. It goes in line with what I say, that having empathy doesn't mean you don't have boundaries. Empathy isn't soft. It's very courageous, because you're walking into these situations and you're going to have to lay down boundaries, and you have to protect yourself. Mm-hmm. You have to. And as far as it being a calling and not just a job, I kind of feel like any job you're taking on where there's going to be a level of risk, mm-hmm. and you're dealing with people, especially mm-hmm. delicate populations, like a teacher, like someone clinical, we could even take this to some people that work in the prison systems. You're dealing with people. This can't be just a job, because if mm-hmm. it is, you shouldn't be working with people in that kind of an aspect.
In their vulnerability, in their heavy vulnerability. Yes. You're seeing patients, and again, I'm talking about this on anybody who works in a hospital has a calling. That's my agreement, because you're seeing, like, even the ward clerks that I work with, They have to come in and I have to tell them, listen, I have to tell them the doctor wants this blood test, this, all of that stuff. If the doctor's not there, they have to physically be around to see to hear what's going on, to be told what to do so that they can make all the logistics happen for this patient. Right.
Yeah.
And they have to be there to witness the CPR. They have to be there to witness the family members crying on their knees. They have to be there to witness all of these things. So every person, and the housekeepers got to be there to clean up the mess afterwards, after they just watch. Like, do you think that it's easy for example, let's say a family member has their loved ones coming into the hospital because the ambulance had to do CPR and bring them in. My cousin had her father pass away, and she had to do CPR on her dad, and she brought him to the hospital. Unfortunately, he didn't make it. And when she came home, do you understand how hard it was for her to pick up the mess that was laid on the floor with all the stuff? Oh. And the housekeeper has a bit of that too. There's a vicarious trauma that comes with that as well. There's also the fact that the security guard has to lock down the hospital because there's a perpetrator on the loose coming to finish off the job for the patient that's coming in with the gunshot wound. This is just a never-ending cycle. So anybody that works in a healthcare institution has such a vital importance there. And there is a form of it that is a calling to them. And you play such an important role in this. And there's a burnout that can happen in those professionals as well. We're not going to underestimate that. And we need to, and we need their empathy as well, because I need them to be on point when I'm in the middle of doing CPR and I have somebody else taking notes and I need someone to make sure that this happens. And with all of this being said, why are we not targeting the issue as a whole? Why are we not evaluating why our healthcare professionals are not performing, rather than just, okay, well, you're not performing very well, or we're not having, you spoke to that patient incorrectly. You should be suspended. Well, did you not realize that about a month ago, I almost got attacked by patients, or I did get attacked by patients, and I got some time off, but no one really did a follow-up to make sure that I was okay in their workplace. These follow-up ministries, these follow-ups show empathy from the manager's perspective towards the nurse that will then eventually trickle down to the bedside care. We have to evaluate the way we manage our staff. And I was a manager at one point.
Yeah, but you're learning. You're saying we need to do this better. So that's precisely who I want to see in a management position. Not someone who says, we're going to do it this way because this is how we've always done it. Mm-hmm. Someone who says, there's something not working with the system and we can innovate and make better. We can do better. We can have better.
Yeah.
So that's exactly who I want.